Xapimed's reporting is designed to be agile so that you are able to quickly pull information that you need at that point in time. You can think of the activity being done in Xapimed as data points, and the goal of the reporting system is to present that data in a meaningful format. I'm going to now run through a few use cases to show you what this looks like. I want to see a detailed report on the defined competencies required for staff nurses working in the oncology unit at Riverfront A Hospital. By reviewing these, I can verify if they align with the needs of the patients they serve and the kind of care, treatment, or services they provide. Going to the skills matrix in Xapimed, I'm able to filter it by a particular job role and location. In this case, staff nurses working in the oncology unit at the Riverfront A Hospital. This will pull up the defined list of competencies that my organization or unit has chosen as competencies nurses with this job role need to have. I can also see the status of nurses against those competencies. We want to reduce epidural catheter infections in the oncology unit at Riverfront A Hospital. Staff nurses need to be reassessed on their ability to provide epidural catheter care. On my Xapimed skills matrix, I'm able to add clinical skills and see the status of my team against it. Going to the setting, I'm going to add skills, and in this case I'm going to add providing an epidural catheter care. Scrolling down to that competency, I can see I have 4 nurses who've had it verified, 5 nurses who are not applicable, and 2 nurses who have not had it verified yet. I would like to review the initial competence assessments for a new nurse before they are allowed to perform urinary catheterization. I would also want to see what action was taken when a nurse was found to have incorrectly performed urinary catheterization, potentially causing discomfort to a patient. In this pathway, a new nurse will first start off with a urinary catheter insertion and nursing care group training session. They'll then have to do a post-test after they've completed that session. Upon completion of that test, the staff nurse would work with a member of the nursing education group to do a return demonstration checklist. If the nurse passes the return demonstration checklist, they will be awarded the competency, and then they will have to recertify in 1 year's time. If the staff was unsuccessful, their line manager will get a notification, and then they'll go through a coaching workflow with the nursing education team. I would like to see records of a nurse's competence assessment in urinary catheterization over the past year. On my skills matrix, I can drill down into a particular nurse and view their timeline of the competency. On this timeline, I can see that there was a case study verification done on the 1st of August 2022, and then there's another return demonstration verification on June 1st, 2023. If I wanted to go into more detail, I can use the skills activity report in Xapimed, search up that particular skill. Scrolling down, I can see all of the nurses' competence in that particular competency, the verification method that was used, when it was verified, and who it was verified by. Again, I'm able to drill down to a particular person if I need to, or a particular job role, organization, hospital, or unit. Likewise, I'm able to drill down into the nurse's task history to see every task that they have done in the Xapimed system. I want to understand details of a competency evaluation. In particular, show me how a competency was verified, who verified it, and when it was done. Using Xapimed's task activity report, I can search by a particular competency. For example, if I wanted to look at urinary catheter insertion and CORDI, I can scroll down and see how each of the competencies were verified. In this first case, Ali has taken 7 minutes to do this test and passed with a score of 100% on this date. On the other hand, Libby has failed with a score of 50%. We can also see that Helen was assessed by Jodie Lee through a return demonstration checklist, and Helen has passed with a score of 100% on this particular date. Clicking on any of these items will open up the checklist for you to see the results. You are also able to configure who is allowed to verify the checklist for each verification method. In this return demonstration checklist, I have chosen the assessor to only be people in the nursing education group. Some other examples could include a group of preceptors working in that hospital, it may be a select few individuals who can only sign that skill off. Or maybe if it was a low risk skill, it could be a peer review from somebody who already has that skill signed off.